not sure how many people will even watch this at this moment while it's live because I still have a very small following list. Anyway, sorry, my husband's writing me while I do this. I wanted to go live just because it would be easier for me to talk about it than worry about uploading it later because sometimes I forget. So I just had like, you know, pretty extensive like back surgery, bigger than what, uh, basically bigger than even what my doctor thought probably would happen. So I went through a rare back brace is driving me nuts. A rare spinal infection, and that was life-threatening, and it caused permanent bad damage to my lower back. My lower back already had problems, so it just made it a lot worse. It ate at bones. It caused like a scoliosis in it, and it completely just destroyed a couple of my discs. Or at least one of them was just like not there anymore, and one of them was really just like super bulged. And I also had a bone spur that was pushing in on one of the main nerves, like on the inside, so it was hard to pick up on its scans. So doctors had a really hard time understanding why I was in pain, and it was frustrating because with the spinal infection that I had, when doctors and nurses and everybody realized what I had, they were all over taking care of me. They were so concerned. They were so nice and patient and sweet and helpful, and they helped manage my pain, pretty well. I was surprised. I was worried they wouldn't. And then that whole time, I mean, it was a good experience, even though I was really like ill, and even though it caused permanent damage. Unfortunately, the damage progressively got worse, like very quickly, and um, so when it came time for back surgery because of what the infection did, I heard rave reviews about my surgeon, and I had to pick between a few different ones, and he was the one I wanted to go with because he does a more minimally invasive one. In my case, I ended up with 3 incisions instead of 2 because of a minor complication that came up in the middle of surgery, well, near the end of surgery. So in this case, here's what was so frustrating. I'm in a hospital that gets both really good reviews and bad reviews, and I guess it depends on the department you're in and the floor you're on, kind of a thing. And after getting back surgery, like, I remember waking up, of course, out of surgery, you're going to wake up in pain. I woke up in pain, but I also woke up not being able to feel my left leg. I still don't feel half of it. But that's not my main complaint right now that I'm talking about. It was the complete difference in treatment that I received. Like, it was total opposite treatment. After back surgery, my pain medication was not increased at all, so it was as if my system got a shock, basically. Like, might as well have just given me surgery without any pain management. So it was horrible. The whole first day, it was a nightmare. I hardly remember very much about it, except that there was people not caring so much, and the doctor didn't really believe I needed a stronger pain med, and I was like, remind him that he agreed to what I was on, remind him that he knew about this, and that I can't just be on the same that I was on before. It's not helping at all. It's not going to make a difference. And when he was reminded of that, then he raised it to a higher dose. And then after 2 days of a slightly higher dose, like barely I mean, in frequency, I think. He finally raised it to a higher dose, so frequency then higher dose, and it still wasn't. I mean, it helped. It did make a difference. It took like the very tip top off. So instead of being in level 9 and 10 in pain, because I was at level 9 and 10, I was crying. I couldn't speak right. I couldn't. I mean, it was so bad. And the difference between that and then when I had the pain medicine increase slightly, it went from a 9-10 to like an 8. An 8 to a 9 sometimes. And his nurse practitioner had the nerve to tell me that, oh, we send all our patients home at the level 8 and 9 in pain. And I'm looking at her like, you've got to be kidding me. You're lying to me. That is not controlled pain. People who are in that much pain, the pain isn't under control. You need to be around the 5-6 range, at the minimum, to have it feel under control. Still being a lot of pain, but it's being controlled. You can handle it. But at levels that I was at, you can't. And she was demeaning, belligerent, belittling. She talked down to me. She chewed me out. She was downright rude and mean and cold and cruel and argumentative and defensive. And I couldn't believe it. And I honestly believe that all the times I kept telling nurses, please tell them that I am in severe pain. I can't sleep. I can't eat. I can't move. I can't function. I can't think. I believe that the message was getting to her because after my surgery, after a couple days, he ended up, well, after like a day and a half of it, he ended up leaving out of town. And I didn't know that he was gone. So the messages were getting to this nurse practitioner. And so I believe that she was just blowing me off because that was when she came in to see me. And it was, I felt totally abandoned and neglected. I felt uncared for. There was like, all the nurses were really young. Most all of them were not even married yet. They were so young. They're brand new. And the thing is, in this day and age, a lot of the millennial and even the Z generation, they're very narcissistic people. They're very selfish. I'm just saying it like it is, okay? Like, it's not your fault. It's like my fault and parents older than me's fault who raised kids to be this way. But also so did society and the media. They raised our kids to be this way, to always be worrying about what people think of us and what we look like and this and that and the other. And we don't have time to put in the care and thought into other people and how they feel and how they think and how they see things. And so here we are, stuck with medical care that a lot of them just, they don't care. They just don't. They can't relate with you at all what you're going through because most of them haven't had any children, probably not even broken a bone. So it's really sad because, oh, hi, Kaylee. Or, yeah, Kaylee. I like calling you Kaylee. It's a cute name. Lacey misses you immensely. You have no idea. She's like going freaking nuts. Like she keeps talking about, oh, I got a party. She's like, oh, but Kay's not here. She gets so sad. Oh, and then we traveled back east. She wanted to see you so bad. She's like, are we going to be right under New York? I was like, yeah. She's like, do we have time? And I was like, well, it's like 6 to 8 hours away. So we knew we wouldn't have time. But anyway, time to see you. But anyway, so what's really hard is I wish so much that there was more compassion in this world. There was more empathy. There was more understanding. And I'm not talking about just for people that are minorities or discriminated against. They're not the only ones that suffer. Other people suffer too. Like people who are sick, people who are hurt, even people who don't have cancer. Like cancer gets a lot of raving attention. Well, there are other terminal illnesses out there where people are severely and seriously suffering. And people just, oh, that's boring. They don't care. So anyway, I'm in there. The nurses, I would hit the nurses button because I had to pee and I couldn't get out of bed. They just wouldn't come. They never brought me a menu until the night before I left. So I was there for like 2.5 days or 3 days or something. 3 days. They never brought me money to eat until the night before I left. I'm like, wow. You know, they didn't even care. They didn't offer me anything. They didn't fill my water when I needed it. They'd forget to give me my meds even when I'd push the button. And I'm talking about regular meds I take, like stuff I have to take. They messed up my heart medicine. They messed it up bad. So my heart started going all nuts there, and they didn't even have me on a heart monitor. I'm like, what's wrong with you people? So I had some AFib events, and the oxygen monitor picked it up, but I wasn't, they weren't watching my heart. And they they thought it was just for high blood pressure. Like, your blood pressure looks good. And I'm like, I told you, it's not for my blood pressure. This is for my heart, for AFib, for like really bad PUCs, like the ones that can give you a stroke. Like, oh my gosh, I was so frustrated. They did not listen to me. I had to repeat what my medications were over and over again. I even wrote them down. I wrote down what they were, the dosages when I took them, all the details. I said, here it is. And they still didn't get it right. Several nurses messed it up. So now I'm still having heart problems to this time. Last night I was up most of the night. My heart just, because it's all messed up now. They totally screwed it up. And I remember being in so much pain and needing help getting out of bed, and luckily I never fell. And when I told them I wanted a shower, you know what they said? Well, I don't really have time. Seriously, I don't really have time for that. And I'm just like, are you freaking kidding me? I'm like, because they're the nurses the CNAs that help with the showers. She just didn't want to help me shower. And she walked off rolling her eyes, and she looked like she was barely out of high school. And I mean, yeah, some CNAs can be barely out of high school, and I don't have a problem with that. There was another CNA that was there that was super, super awesome. She was the best person there, hands down, of anybody that was there the whole time. Of all the nurses and doctors, she was the best. She was sweet, compassionate, caring. She was there pretty much every night I was there, and she helped. And she wasn't mean. She wasn't impatient. She didn't roll her eyes when I'd say something. But when I was in the hospital with the osteomyelitis, the infection in my spine, it was like every nurse in there was just like pandering to me, and doctors, and I would have video calls with doctors. I mean, it was major difference. Like, when there's something that is so common and people are so used to it, it becomes a commonplace thing, and people forget that just because so many people have back surgeries doesn't mean it doesn't hurt just as bad, and doesn't mean they don't need that care just as much, because they do. It's just when I had the infection, it was a new thing, and it was intriguing to them. And so, yeah, I feel like that's what the difference was. It wasn't me. I mean, it's not like I was two different people. It was, the situation was different, and I was on a different floor in the hospital, and the staff was totally different. The staff on the floor where I had my infection, they were much more seasoned nurses and stuff, and even traveling nurses, and they were amazing. And then you had the ones on my floor that were brand new, just out of school, that had no experience. And I'm just like, oh, I guess medical, you have to start somewhere, but at least please try, forget how the person looks, forget what they sound like, look beyond that, and be like, okay, what is in this person's soul and heart? How are they feeling? Try to get it. Like, even if you can't even understand it, like, it's too hard to compute, try to remember if you ever broke a bone, how that felt, and how much worse it could feel if there's something worse going on. So I did feel super neglected, and even the staff that was supposed to check on me at home, only one of them came. And so I was forgotten there, and it's been a bit rough. I'm healing faster than I expected. I will eventually do a video showing the incisions, the steri strips came off. All of them came off, not yesterday, day before, Saturday. So, anyway, oh, and Kaylee, I don't know what I should call you because I know your mom likes Kaylee, and you go with Kay from some, Lacey and some of your other friends, but um, yeah, I think it would be a really great experience for Lacey to go and visit in New York. It would be great for her to travel by herself somewhere or whatever. I got to do that once in high school, and that was a great experience, so that'd be really fun. Um, right now, Lacey and Sophie are in Young Women's Camp. They just left this morning. It's only like a 2-day, 2-night thing. They come, well, 2.5 days, I guess. They come home Wednesday morning, left Monday morning. So, Monday, Tuesday, yeah, two days in a morning. I don't know, whatever. Anyway, so we just have the 2 little people with us, Liam and Sadie, and Marlene took them out, which I'm super grateful for, because Tyler's not feeling too hot. His medication's totally screwing with his head, and I am in a lot of pain, and I can't pick anything up or do anything, so I feel kind of worthless right now. And I'm wearing this obnoxious back belt brace, but it is very helpful to have, especially if I'm walking around, because I've already fallen on the floor once. Oops. And we got a couple of new kittens. They are super adorable. They're really, really sweet. Their personalities are awesome. And I'll have to show them later. And one of our rabbits is going to have baby bunnies soon. Like, she's nesting and, like, ready to have, I think she's probably going to have 2 or 3 babies. Oh my gosh, can't wait. They're going to be so cute. Baby bunnies are so adorable. Just like little teeny kittens, little teeny animals. They're so cute. Anyway, I am sitting outside at the grocery store waiting for Tyler to pick up some medicine and toilet paper before the little kids get dropped off back at home again. So anyway, just wanted to give an update and talk about the differences in treatment and care and how it differed. I mean, I'll say about the pain level difference, yes, the spinal infection is more painful than major back surgery, because I had a triple laminectomy, a double bilateral fusion, and a full discectomy, and I don't remember if he took the other disc out or not. I know he took one out. He could have taken both out, but they're fused on both sides. He went in at both sides, either side of the spine, and then one screw went in and went too close to the nerve, because I can't remember that part of the bone that they attached it to was too thin, and I think it was from the infection, and so they had to go in through my butt, not my butthole. They had to do a 3rd incision on my butt cheek. He went up my butt and he fixed it from the inside. Oh my gosh, no. Oh, that would be a nightmare. No. Anyway, yeah, little incision in the butt cheek, and that was really painful. It's the largest muscle in your body, and having that cut into, like, you wouldn't believe the pain. Like, I swear that little incision hurt as much, if not more sometimes, than the larger incisions, especially the muscles. I'm just like, that extra amount it made the pain insane. Like, it was insane. So, yes, the surgery pain was awful, 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 awful. Especially the muscle spasms, because they were pretty severe. But the infection in my spine, that was, yeah, wow, whole nother level, I guess. But like I said, they managed my pain a lot better with that once they figured out I had it. Before that, they did not manage it at all. They refused to help treat my back pain, even though I had an infection and they didn't know it. They didn't even look into it. But because it is rare, they didn't know to look into it. But no one believed me in how bad my pain was. No one believes me when I say my pain is that bad. I'm like, look, I've been through this, this. I know what severe pain feels like. This is severe. Okay? This is severe. Minor pain to me, it hardly phases me, because the pain I'm used to dealing with is much worse. So, Anyway, so I just wish that they had taken more care into it. Like, they're so paranoid about pain medications these days. They don't take into account who you are, what your track record is, how you handle medication. They just assume everybody's an addict. They just do. They treat everybody like they're an addict now, and that if they give them a dosage that people used to get, it's gonna just kill them like that. That's just how they treat everybody. I mean, everybody's treated that way now. It doesn't even matter who you are. Like, if half a pill, like half a 5 milligram, knocks you down flat on the floor, or if you're someone who could take a 20 milligram pill and you're still up and going, they don't care. Like, they care only about their license and how they look. Period. That's it. I mean, it's just purely one thing that's motivating them is to keep their license. So, unfortunately, patients are suffering unnecessarily because this war on drugs is targeting the wrong group of people. I just have a lot to say about that. As you can tell, I can get a soapbox about that. Anyway, I am weaning down my medication. I can do that on my own. I'm fine doing it. I just want to be able to have what I need while I'm going through it. So annoying. So frustrating. Blah. So, okay. That's the end of that spiel for you. This is way too long already. I can't even believe I talked this long. Love you people. And I'll talk to you later, okay? Bye.